So I'm going to be doing medication administration injections. So I'm going to knock, enter my patient's room, provide for privacy. I'm going to greet my patient and identify myself. Hi, my name is Brooke. I'm going to be your nurse today. I'm going to ask my patient for their name and date of birth and check their wristband to make sure everything matches and I have the right patient. And then I'm going to explain what I'm going to be doing that day, which is giving their medications, and then I'm going to wash my hands and put on my gloves. So I've checked my medications already. I've drawn them up and checked them 3 times. Once when I was looking at the MAR to verify the provider's orders, once in the medication room when I was drawing them, and then a 3rd time at the bedside before I give them. And when I'm checking my medications, I'm checking them to make sure I have the right patient, the right drug, the right dose, the right route, right time, and all the documentation is correct. And then I'm also going to look at my patient's allergies, make sure they're not allergic to anything, and I'll take their vitals if I need to beforehand. So I'm going to start with intramuscular injections. You can give intramuscular injections in the deltoid muscle, ventrogluteal, or vastus lateralis. To find the deltoid, you're just going to find the acromion process, and then you're going to go about 3 fingers down, and you're going to give it right there in the muscle. And then to do ventrogluteal, I'll have you stand up like that. And then I'm going to put the heel of my hand on their greater trochanter, and then it's just in between those 2 fingers right there, and give that in the muscle. And then to do vastus lateralis, you're just going to put one hand on the top of their thigh and then one hand right above their knee, and you can give it anywhere in that area of the thigh. So to do an intramuscular injection, you can also use Z-Track method, which I will be using today. So you're just going to take your alcohol prep pad and wipe their skin off. And then for the Z-Track method, you're just going to take your 3 fingers and you're going to pull the skin back to create traction. And then you're going to take your needle at 90 degrees and insert. And then I'm going to hold it with these 2 fingers and I'm going to aspirate to make sure I don't get any blood. And then I didn't, so I'm just going to inject. And then I'm going to let go of their skin, and I'm going to take my prep pad and I'm going to hold pressure where I just inserted the needle, and then I'll have a bandage ready for them if they need it. And then this will go in the sharps container. Next, I'm going to do subcutaneous. So you can do subcutaneous in the abdomen at or 2 inches below the umbilicus, anywhere around the area. So his umbilicus is here, so I can go anywhere in that area. And then you can also give it on the outer aspect of the upper arm back here, and you can also give it on top of the thigh. So to do a subcutaneous, you're just going to take your alcohol prep pad and prep their skin, and then you're going to take your needle and you're going to go about 45 to 90 degrees. So you're just going to pinch their skin and insert, and then take your prep pad and hold down, and that will go in the sharps container as well. And then for an intradermal, you can give that on the inner forearm, or you can also give it in the scapular region of the back right there, and that's usually used for allergy testing. So you take your prep pad and prep their skin. And then this one you want to go bevel up, and you're going to go about 15 degrees below the skin. And insert, and then you'll get a little bubble underneath their skin. And then just pull out your needle, and then you can give them a bandage if they need it. And then that will also go in the sharps container. After I give my medications, I'm going to make sure that I document the patient, and I'm going to document what medication I gave them, the dose of it, what time I gave it, and then where I gave it and what route I used to give it. And then I'm going to come back in about 30 minutes and make sure it had the therapeutic effect, they didn't have any adverse reactions or anything to their medications.